So, having now heard about why trials are important and how they can be delivered, from Amos's pictures, there's somebody who's going to speak to us now, both being at the sharp end and at the centre of it all, and that's Yvonne Brown. And I'm afraid, yes, there she is, who's going to talk to us about what it's like both at home and abroad from a parent's point of view.
Okay, hello everybody. My name's Yvonne Brown. As you know, I had a child who was diagnosed with neuroblastoma in 2006 when he was 3 years old. He'd suffered from imprecise symptoms, which now seem the obvious omen of the real issue. But at the time of their display, we entered into an uncertain and a frustrating relationship with our doctors and our healthcare professionals, who seemed divided in their potential explanations of leg pains and drifting fevers. It took 6 weeks for Jack to be diagnosed. His first symptoms were limping, leg pain, couldn't stand the light. Eventually, when a mass in his mouth arose, they took a biopsy from there. Neuroblastoma tumours can double in size within 5 days. 6 weeks was a long time. It was frustrating, but at the end of the day, we would accept that he probably had stage 4 disease when he showed signs of his first symptom in any event. It's a very aggressive disease. We weren't given a great statistics when we took him in. We were very disappointed, shocked, relieved when we actually had clarity of Jack's diagnosis, thinking clearly we would have now a plan that could relieve his pain. Jack went through first stage treatment, chemotherapy, but that did nothing to help him. He then went through MIBG therapy with Dr. Gaze, which was partially successful. He then had the tumour resected and high-dose chemotherapy and was declared disease-free at approximately a year later. We had looked around quite a lot on the internet to try. I'll take a step back. We were frustrated at the end of treatment to be told that despite everything he'd been through, his survival prospects still stood at about 20%. He'd fought extremely hard. The internet is a wonderful but frustrating thing. We found trials in America that were to do with antibodies, immunotherapy, that were designed to prevent relapse. We spoke to parents in America, we spoke to doctors over there, and decided we would take Jack across for the antibody therapy, which was on trial at Sloan Kettering in New York. Our experience of New York was very different to Millie's family, I have to say. The Ronald McDonald houses all over America are very different. It was like walking into a hotel, 85 rooms, wonderful support network. We spent probably about the next year there simply because after Jack had 4 cycles of immunotherapy treatment, during which time we commuted, we found 8 months later he had relapsed, and it was brain relapse. We found out because he was complaining of headaches, took him to the local hospital, who'd done the CT scan and found a tumour in his brain. The next day we found ourselves at Great Ormond Street Hospital, and we were told that if we didn't fly that night, Jack probably wouldn't be able to fly. New York was the only place that offered any hope. They had a trial called 8H9 therapy. It's a phase 1 trial. The first child to undergo it had underwent it 6 years earlier, and this was 2006, and that child was still doing extremely well, had never relapsed again. With neuroblastoma, once a child relapses, it's prone to further relapse until it's game up. So that gave us some hope. We were very, very nervous about it. Came across the intention in our heads was if we need to leave and go back, hopefully we'll be able to do that, because New York were prepared to give steroids and things that might decrease the size of the tumour in the brain if we didn't decide to go through with the trial. The support of the other families within the Ronald McDonald House was immense. One of the reasons we chose America is because here only 100 children are diagnosed with neuroblastoma a year, whereas in America it's 650 to 700, and at that time most of the families would travel to Sloan Kettering. So it figured that Sloan Kettering probably had the best up-to-date knowledge and would be able to cope with any complications. Jack had the ADH9 therapy there, and we had a wonderful time there. We had 2 other children, and going back to the Ronald McDonald House again, even if we'd wanted to leave, I don't think our children would have let us, because they had such an amazing and fantastic time. It was very, very worthwhile. Jack, obviously, he died in 2009, but he had a very, very happy life. Now, I'm going to refer to some notes my husband has prepared, because he's terribly eloquent, whereas I will give you my experience of being there. So I hope you don't mind me reading some of it, but I'll interact with what I want to say at the same time. The people and the places. The differences are less than one might think. If you engage with whomever, wherever, you tend to find a repayment in kind. They engage with you. Temp jargon and location may change, but you are already by this point fluent in neuroblastoma, and while the local dialect might differ slightly, both sides want to communicate. It's my experience that because you've positively chosen a course of action that is beyond the ordinary, those with whom you now interact intuitively raise their general game. It's not that you receive extra, but you will discover more detail about the process, because there's a recognition that you will always be making decisions about your child and their relationship with present circumstances. And what it's talking about is, back at that stage, it was very, very difficult for us to get quick answers from the doctors that we were dealing with at that stage, because you're just another parent, you're not a doctor, how are you ever going to understand? When we went to America, we found a very, very different relationship with the doctors. They knew you'd taken the time to research, and therefore you must have some sort of not an education as such, but you've learned, and you've learned quickly. Of course you do. Your child's life's on the line here. And so they would interact with us. We, during the 3.5 years that Jack was in treatment in America, would be back and forward, commuting as much as we could. And our doctors obviously would talk to the American doctors, and really it has gone immensely from there, because other families started to see what we were doing. They saw Jack alive. Jack should have died in 2006. According to our doctors, and they started to bring their children across as well, and so more children started to come, and relations, I feel, got better, knowledge got out, but relations between the doctors seemed to grow as well. Doors, why we chose to enter took us to New York. Doors which we chose to enter took us to New York and then to Burlington in Vermont. We had tried the antibody therapy, which is not available in the UK, and a few other things had happened. Doctors and scientists have subdued reaction to parental evidence, preferring biological theory and documented empirical evidence based upon a trial constructed to test such a theory. But parents are a valid contributor to the understanding of the problem posed by illnesses like neuroblastoma. We are fallible barometers of our child's condition and their regimens. We found that at both American hospitals, attention was paid to our observations and considerations. We were treated as equal and informed partners in the process. The process was correctly personalised to the child and the parent. The movement between different treatment options was normally rapid whenever necessary. With neuroblastoma, the disease is very different in every other child. Probably the same with every cancer, but I can only tell you from neuroblastoma. And one thing will work for one child won't work for another. And in America, if that isn't working, you might have found out by Friday that treatment of his own is not working. By the Monday, there will be something else. There will be another plan that you will start on the Monday straight away. There is no sell intended on my part, because I know the parents who've engaged with children's cancer and their carers tend to have positive recollection of the events. Jack did not survive, but until the last few days, he remained intact. He had matured on all levels, becoming whole and enriching a great many lives. We took Jack to Vermont when he relapsed again following the ADH9 therapy. The ADH9 therapy was a phase 1. He was the last child to enter on the phase 1. It's all about toxicity, how much toxicity can the child stand. And being on the very final tier, the dose that Jack got was too toxic. 2 months later, his blood counts still hadn't recovered, and he was unable to have the second backup dose that had made the therapy relatively successful. So Jack relapsed again, At the time, Sloan Kettering had run out of 3F8 antibodies, and we took Jack to another doctor, Giselle Scholler, up in Vermont, who was running another drug. That drug didn't do an awful lot for Jack, apart from the fact it brought his blood count soaring back up and gave him 3 weeks where he had no need for any platelet transfusions, any blood transfusions. First time since 2005 that he had 3 clear weeks without any transfusions and could go swimming and had a wonderful time. But the personal message about personal medicine: there are small things about trials everywhere. Trials involve the same phasing as in the UK. Does it harm? Is it effective? And in that order. The travel, the accommodation, the culture, the people, the absence of friends and family, fear of the unknown fits into each of these categories, but the fear of the unknown should not prevent. Equally, the fear of the probable should not, of itself, sponsor action. The travel is over once you're there. A bed is a bed, people are people, and friends, lots and lots of friends come forward. The message to families is: do not allow fear to push you through a door, but do not let fear bar your entry. Each child is personal. Each child's cancer is personal. Each child's family is personal. Each child's nurse and doctor will be personal. Every family will physically be able to take their child further afield for treatment, but each family is unique. Their circumstances, their child, their illness. Knowledge empowers each family to make a decision with their doctors. It gets to the stage where every family, when they enter a new trial, will want to look and see what's happened before to other children, what's the success rate, what's the outcome. It'll get to the stage, certainly with us, where there was only phase 1 trials left, where your child would be the first child to enter that trial. Such a hard an individual decision to make. With us, Jack was happy, remained extremely happy, never particularly sick, although he had cancer. And so we chose to put him into Giselle's trial. Like I say, it didn't work, but it gave him 3 weeks of normal, happy life. We lost Jack to septicemia. He caught pneumonia, and his blood counts were very low at the time. So as a side effect to treatment, we accepted at the time that we would probably always lose Jack to neuroblastoma, but while he was happy and he had fight, we chose to fight the battle with him, but Jack led the way. We have no regrets. We are so glad we've had that extra time with him, 3 years. Things have taken massive steps since then, and we see the international collaboration now, which is amazing. Days like this are happening more frequently, which are amazing. And knowledge is getting out there. Parents are working with families, and it's such a difference. And to Millie's family, I can only sort of say you're sort of one of the many that have taken the step and gone abroad, but it's so, so worthwhile. Thank you very much.